Great to see you, Greg.
Good to see you, Audie.
I am so glad that you are running this race.
Me too. We tried talking about a different one now 4 years ago, and I'm sorry it took me 4 years longer, but here we are. Hi, I'm Greg Casar. I'm running for Congress in Texas's 35th district, and I'm running because I believe that working Texans deserve a progressive champion who will fight and deliver on Medicare for all, reproductive rights, immigration reform, tackling the climate crisis, and creating a better Texas and a better country for all.
What has your experience and that of family and friends been like with the current U.S. healthcare system? Has it served you and your family well?
The current U.S. healthcare system hasn't served virtually anyone very well when I talk to people, especially in their time of greatest need, especially when they have very intensive needs for very intensive kinds of care or different kinds of care. And it oftentimes hasn't served them well at all. Now, of course, when folks are of much higher income, then, there's just such incredible medicine that can be available to people. But that should be available to people no matter how much it is that they make. These are usually innovations or drugs or procedures that we all came up with collectively as the public, and we want that to be accessible to everyone. But then, Audie, as you've shared in your own story, though, then sometimes we can even be surprised that people who have a lot, who have law degrees and are very connected and plugged in and have a decent salary, even still can be just a step away from having just a massive bill in front of them and getting rejected by insurance companies. So to me, it's just really clear why it has to change. And it's been most clear, I think, here during the pandemic, when so many people have lost their jobs, and the idea that you could just lose your health insurance because of a loss of a job, tying your health care to being employed makes even less sense, I think, now that we've been through a pandemic where suddenly you had these huge spikes in health needs tied with people losing their jobs.
Greg, I'm curious, what do you think is one of the biggest healthcare issues that Texans are facing right now? And how would you propose to tackle?
So Texas is the most uninsured state in the country. And so that means you have constant crisis after crisis for tons of people every time that they've got a serious and acute healthcare need. But then also it's just pretty constant because people don't have doctors and don't have regular care. Obviously, as we've all talked about and know, the big structural way of dealing with it is to pass a single payer Medicare for all system. And in a place like Texas, I really think that means for all, including for our undocumented brothers and sisters in our state. But then there's also, really baseline immediate ways that we need to be addressing the lack of health coverage in Texas. So for example, our governor continues to refuse Medicaid expansion here, but we have cities and counties and local hospital districts that would gladly participate in that. And so I think for places like Texas and other states where we are controlled by these right-wing regimes that for politically craven and disgusting reasons leave people without care, that we should be thinking about in Congress ways around that and thinking about ways to allow cities and counties and hospital districts to expand Medicaid, to think about ways on all sorts of other issues that we direct federal funding more towards those local elected officials working together, as opposed to just the states where we so often have things like governors and state legislatures that are not only, doing political posturing by denying election results and undermining our very democracy, but then go as far as taking away dollars from people that are in such critical needs and dire straits.
Can you tell us about access to abortion right now in Texas?
Yeah, it's such an important question. We are in a place right now in Texas where abortion is virtually banned for low-income people in our state and virtually banned even for many middle-income people. Asha, my now fiance, her job, part of her work, is to talk with women who are in Louisiana, New Mexico, Oklahoma. They're from Texas, but they're in those places at clinics to receive abortion care because it's been virtually banned here in Texas. The week limit that was set in state law is so early that many people don't even know they're pregnant by the time that abortion is banned. And then there's such serious restrictions on medication abortion as well. And so we are in a real moment in state of crisis on that issue for all people, but especially for low-income women and for women that are outside of, that are, further away from the edge of the state. Especially if you're down on the border or if you're deep into the middle of the state. It's a huge state. It can take over a dozen hours to drive across it. And so there are people who, cannot take time off of work and then go to Oklahoma or go to Louisiana in order to get abortion care. Even more serious when you're talking about young women and young people who, may not be able to tell their parents why it is that they need to leave the state. So it's really just awful. And so it makes it just increasingly clear and critically important for us to both codify Roe v. Wade as law and repeal the Hyde Amendment. And again, the vast majority of working Texans disagree with the current state law. Just like the vast majority of working Texans don't think we should have GoFundMes to pay for life-saving medication, just like the vast majority of working Texans believe we should have at least a $15 an hour minimum wage. But that's not reflected in our government, right? It's only a minority position amongst elected officials, but it's a majority position amongst who is governed. And so that's, I think, what has to change in Texas, but really it's what has to change across our country. But I think Texas is where it comes almost most starkly into relief, the real difference between what people want to see from their government and what people are experiencing right now under these really oppressive laws.
What is your theory of political change? How do we build that better healthcare system, and what role do you see for yourself in that theory of change?
My theory of political change is that the change has always been driven by the power of organized people. And I think that in Texas, I've seen how that power of organized people can make political change. I started this work as an organizer as my summer job. And then I committed to that long term, where we and my construction worker members that I was organizing alongside were just asking for the basics, like water breaks, from a city council that was composed of 7 Democrats. And we saw how City Hall was really built to support the construction contractors more than construction workers, because it was really hard to win basic things like the right to a guaranteed water break. Or back then we were asking for a $12 an hour minimum wage. But I saw how real coalition building and really bringing together not just our construction worker members, but restaurant workers and custodians and retired state employees and environmentalists and a new activated base of young people could really try to start shifting the conversation by showing how different what City Hall's priorities were from what people actually expected of their government. And, the last 8 years of my time in life have been then running for office and trying to govern in an inside-outside strategy to move what City Hall was doing from focusing so much on corporate interests and those people that are already doing well towards the interests of working people and everyday people. And it hasn't always worked perfectly. It certainly has not been easy. But my theory has been that every time that we have working folks lead and that we're thinking about organizing and that we recognize that we are standing for what most people actually want and need, that in a functional democracy, some of that stuff can shift. But then I've also seen its limitations at the local level, because all of that is contingent on actually having people that listen and believe in democracy and respect the rules. And of course we don't. I think that's been exhibited by me working to pass and author our paid sick time laws, which we did in collaboration with a whole movement of people. The law we wrote that was really written and led by folks that really had experienced horrible things because they didn't have access to paid sick time. We passed that law in Austin, Dallas, and San Antonio, covering millions of people. And then in the middle of the global pandemic, our all-Republican Supreme Court made up new law saying that it was illegal. In the middle of a pandemic, they banned paid sick time laws in 3 of the biggest cities in America. And so to me, it's so clear that we need, in a place like Texas, all sorts of change, but certainly one key part of that change would be to have a Congress that's willing to step in and guarantee everyone sick time, or come in and guarantee everyone baseline reproductive rights, and then also come in and end racist gerrymandering and give people access to automatic voter registration and to allow people to vote that are immigrants or incarcerated, to start making our democracy actually respond to people. Because yes, I'm really committed to the organizing work necessary to change laws in our country and our community, but then also to recognize that in places like Texas, we also need the larger reform to even let that work. And so my role in it is I'm just one person here, but I feel like there is this real opportunity for me to use this platform in a place like Texas to both shift the legislative conversation, to help build the coalitions necessary to move the needle, and then also to put myself on the line, because we've seen how freshman members of Congress can do that, be that through direct action or using my bully pulpit, or do whatever it is that the movement thinks is most strategic for me to do, just to aid in that work of making people power work.
You mentioned a little while ago the need for single payer, Medicare for all healthcare system. What is your response to skeptics who say it costs too much and it's unattainable and that's just not something that we can do here?
Yeah, it so often when folks describe it's not just when talking about single payer health insurance, it's also on police reform or immigration reform or so many other issues. They say that we need to find exactly the perfect policy solution that responds to every single critique, or that things will be expensive, or that there'll be backlash. So often, those things are just arguments for not changing, where we wind up changing nothing. Or sometimes it sounds like they're describing the current system, right? The current system is so expensive. Under the current system, people are really unhappy and it causes so many problems. And I also want to be honest to recognize that, yes, sometimes when you do the right thing, there's going to be some disruption, and we can own that, and that's okay. The alternative is to just accept the current system as it is and say that there's nothing that we could do about it. And so I think that's something that's really critical for the Democratic Party, is to stop talking so much about what we can't do and start getting to work on what we must do. And then also be smart about the best way to do that. But when we talk so much about all of the reasons we can't do something, and that's what all of our smartness is dedicated to, that's, I think, what got us in this problem in the first place.
Can you tell me a little bit about how you see healthcare as being connected with some of the other things that you're fighting for, with some of the other policies and ideas you have about how to kind of advance a more just Texas and a more just country?
We've been talking about a Green New Deal and the climate crisis as activists and organizers in Texas for a long time. But there is something about the winter storm that hit just about 1 year ago that really brought it to home in a different way for Texas and for Texans, right? People, of course, especially our lowest income and least resource communities, suffered by far the most. But honestly, it was everyone. There wasn't anyone who didn't lose power and water themselves, or whose family didn't lose power and water, right? If you had power and water, that means that your family didn't. It was just so wide scale. And honestly, I think it woke a lot of people up. So now that when we talk about the climate crisis, there is a very clear way for us to show why we need, sweeping and wide scale change, because it's not a theoretical thing or an anecdotal thing that happens every once in a while. It was for everyone. And right now, the grocery store shelves in Austin are empty because we have another cold front coming in tonight, and everyone remembers what happened just a year ago. And so while people would have said, why would we talk that much about climate change and the Green New Deal and congressional campaigns in Texas, where we are the heart of fossil fuel for so much of the country? Now, in some ways, we really must, and it creates this opening where we really can, because we can just connect it so directly to people's lives. And that's, I think, what's most important for us to try to do. And so I think that the pandemic, which has been just so devastating, and people have lost jobs and homes, and many of us loved ones, that has been so devastating, I think has made it so clear why we can just bring it really home to people what it is that we're talking about. And so to me, talking about Medicare for all and single payer healthcare and connecting it directly to people's experience these last couple of years, and then talking about things like the Texas winter storm and the climate crisis and how we all have to be able to support one another these last couple of years, That's really kind of how this campaign has worked or has been run. It's being able to talk to Texans really directly about like the real crisis that we're all collectively in, but and the only way out is like all collectively to go through it and to help one another. Whether that is on healthcare or having a democracy that respects election results, or on the total sort of loss of abortion access for people that can't take a week off of work and fly to another state, or just keeping the lights on and being able to have water to drink. These aren't things that we all just can figure out ourselves because we're each such independent Texans. These are all things that either we fail at together or we fix together. And I think that that's in some ways how healthcare is all tied up together. I mean, we all have to get vaccines, otherwise all of our kids and grandparents get sick, right? We all have to figure out how to get more renewable energy on the grid that doesn't freeze like natural gas pipes. Otherwise, we're going to be in the dark. And we can all chip into one healthcare system to take care of one another, because at some point we all get sick. And that's how we take care of each other, and nobody's left just out to be alone in the time of greatest need. And so to me, I think that's the way we can pull it all together, is that we can start breaking through that, in some ways, the most baseline thing, right? That we're like we're a society, and that this is what a society should do.
A friend always says democracy is how we take care of each other. And it really sounds like that is what you're describing right now.
Yeah, my answer was way more needlessly long than that, but I'll steal that for for the next time. I only have 30 seconds. No.
Now, I really want to get down to nuts and bolts. Like, how do you plan to win this race that's ahead of you?
You know, these districts were drawn with entirely the wrong logic behind it all. It's all about maintaining incumbent Republican power in the state. But because they wanted to do that, they created these very, very progressive districts. And so in this case, it really connects Latino neighborhoods and communities that I've been organizing in for over a decade, and historic Black neighborhoods through Texas State University, where you have a lot of progressive students, down into San Antonio, where I've been organizing through my work through Local Progress. And so they basically just had to pack progressives in. And so it is a district that is going to be represented by a Democrat. And the question is, what kind? And in this case, it really has the opportunity to be, really progressive. And so I want to use it for all it's worth, right? These maps are wrong, but now let's see if they concentrate a lot of progressive power, then let's see what we can do that with. And so found out about it in October, ran a poll in November, and was starting off with double the level of support of any of the other potential candidates. Our January poll has me about 20 points up versus basically any version of it you run. It's like double digits up. Being the first primary in the country, we have a very good chance of winning in 26 days, and hopefully, creating some progressive enthusiasm and a breath of hope this year, where almost everybody I talk to about elections is like, oh, well, the question's like, how bad and how much are Democrats going to lose, and how embarrassing is it going to be, and how far is it going to set us back? My hope is that we can show folks like, hey, we started off well, and maybe that'll help us with the next ones if we, change our attitude some. That's how I see myself in that context. What's happening with the race is that Eddie Rodriguez, the next closest contender, has gone full negative. The last week, he's sent 2 pieces of mail that has, the tents that people experiencing homelessness live in to survive, next to scary black and white pictures of me doing the thing that I'm sure you see in all sorts of campaigns against progressives. And I guess I could understand that if somebody is ahead, that people start dragging them down to try to force a runoff. And so my goal is to communicate our positive message, because it's such a progressive district, that if everybody hears our bold vision for Medicare for all and Medicaid expansion and comprehensive immigration reform, protecting reproductive rights, repealing the Hyde Amendment, hear about my work on the city council, clearing the rape evidence kits backlogs and ensuring justice for survivors, and raising the minimum wage to $15 an hour. If we can communicate the endorsements I have from folks like AOC and Senator Elizabeth Warren, if we can really communicate all of that to people, then when they get the scary, nasty mailer thing, hopefully our credentials they say, oh yeah, of course they send the sort of dehumanizing, scary, tense mail against the progressive vision, and then hopefully folks throw it out. The problem is it's very expensive, and if they get a bunch of the scary mail, but they only get a little bit of communication from us and they miss it, then it might force a runoff. And then the election then gets stretched into May 24th. And so what we're trying to do, basically, we have an amazing team of over a dozen organizers. We're across all 4 counties. We're doing everything we need to do. I just have to raise my budget and execute a plan with a positive vision. And I think then we could win on March 1st without a runoff.
What's the biggest challenge you are facing in this race?
The biggest challenge in the race is that at any given point, I could find out that there's a $2 million independent expenditure to come and beat up me as a progressive, right? I'm waiting for any given day for me to get the phone call that that's happened. And we're ready for that. And I think we can handle it. Then, though, we know that a day or two after that, we could get another phone call that there's another $2 million independent expenditure. At some point, money in politics is just devastating. There's some amount that nobody can overcome unless, you're already a political superstar, which I'm not. And so right now, as it stands, I think we can win. And we're going to do everything we can that if I did get that phone call, that we'll weather it and get through. We know that the majority of people would support me. So my biggest challenge is to make sure I raise my budget so we can do what we can do and hopefully withstand a normal amount of right-wing corporate attacks.
Who is someone that you consider to be a hero in your life and why?
Oh, that's a really nice question. I was thinking some about my grandmother recently because, I've always been people have been asking me sort of like, where did you get your different values? How did you figure those things out? I've never fully sorted it all through. But I think her story has always sort of taught me some about borders and then always taught me about how you take care of other people. So her mom, my great-grandmother, walked from Mexico to El Paso because her husband, my great-grandfather, was killed in the war there in the teens and the 20s. So she walked to El Paso. My grandmother was actually born in El Paso, Texas. They spent a little bit of time there, then walked back to Mexico. That's where my parents grew up. And then my parents came here. And that always kind of made me think binationally and about how people move and people, at the end of the day, people should have the freedom to just find ways to take care of themselves and their families. And in my grandma telling me about that stuff, she's just always talked about how it sort of looked back to her very sort of Catholic traditional values of you've got to feed the poor, otherwise you're complicit in keeping people hungry. And she's never gone super out of her way on almost anything except just to sort of keep those values in me. And so I just really appreciate that from my grandmother. Adi, now that I get to see you, I did get to spend some time with Congressman Raskin yesterday. Finally got to meet him and he said hi. And reading his story here of the last, it's 2022, so I guess the last 2 years now, so really impactful. And thinking about all the people that have fought to sort of preserve our democracy here these last few years, and it's just like a really heroic movement of people that, have just done so much to be able to keep this experiment in trying to have a democracy going. Really a pretty incredible thing. And then, I'm about to leave city council, and I'll just tell one more story. And I've been thinking about sort of in the last 7 years who I've admired the most. We just settled a lawsuit from 15 survivors of sexual assault who sued the city. And I've really gotten to know some of those plaintiffs really well. And I remember 6 years ago when it all got started, how these women whose sexual assault evidence kits were in backlog, left untested by the police department, how they decided to sue and pressed on and were in the press, and how the police chief at the time said that these plaintiffs were making, and I'll quote him, were making mountains out of molehills. To have people like a district attorney and a police chief be so dismissive of something that was absolutely true and real, I just can't imagine how painful, but also like how much, if it were me, how much like doubt it would sow in me. Like if am I crazy or something about this? But they just soldiered on for like 6 years. And they just didn't give up. And it resulted actually in that DA losing her race. I think this issue and the movement for Black Lives at the same time together, that she lost her race and we now have one of the most progressive DAs in the country. That police chief left our city and actually kind of probably got kicked out of his latest city in part over that issue continuing to brew. And now we have like just such different sets of policies and politics on some of these issues. And there's no way we would have been there if it weren't for them. And it's not fixed. And as heroes in the story. They didn't win the day. It's not like, sexual assault is still extremely prevalent. And, of course, they haven't gone to the world they want where it's been defeated. Their bravery and them being willing to stand up, even when people in lots of power are dismissive, just really brave. And so I don't know. I give you my sort of range of answers because in this congressional race, I've been trying to reflect on different people that have had an impact on me. And that's 3 different examples.
Thank you for that. Here at home, we've been watching a lot of Encanto in recent weeks. Carl knows many of the lyrics, so on that theme, if you could have one gift, one superpower, what would it be?
Oh my gosh, such a good question. The song about the older sister really was too true for me, being the oldest sibling, about, sort of all of the different things being handed over to you, and recognizing that you don't always have to take everything onto yourself. So, I think part of the point of the movie was that part of our superpower is recognizing really who it is that we are and what it is that we do. And so I think I would probably want to learn from her and learn from that about just trying to be really vulnerable and try to maintain my sort of humanity through this job. If I'm fortunate enough to win this race, I don't know exactly how to do it right or what will be the right way to do it, but my preferred superpower will be to not just keep on whatever she was doing, adding more and more oxen to her that she was carrying or whatever. Not just put it all on my plate, but to stay connected with friends and organizers and people to figure out how we share the load. Because I think that sometimes with political office, you can become more and more isolated. And I just want to make sure I don't do that or feel like I'm the only person that knows the answers. And I think I've learned some of that through my latest job, but it's just something that I want to be able to hold on to, is to sort of stay vulnerable and human and stay connected to friends so that I can do this the right way. But it was a good movie. I'm glad that Carl liked it.
Thank you so much.
Thank you so much. It was really good to see you both. I didn't know I was going to get the chance to see both of you today, so it's really, really nice to spend the time with you.
Thank you so much, Greg. It's been
Say hi
great
to me. Bye.